Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended, not meant for children. And in this video, we will be discussing about an intumescent cataract, how to go about doing a minirhexis, and how I came through after accidentally puncturing the anterior capsule by the side port while making the side port incision. A proper staining of the anterior capsule is a must. So underneath a air bubble, you need to actually paint the anterior capsule, which gives a better contrast while doing the rhexis. The chamber has to be kept tight with an OVD. A triplanar incision is being constructed. The cataract is so intumescent that the chamber is very shallow. So while entering with this side port, I just nick the anterior capsule and the risk of capsule running to the periphery becomes high. Now my plan is to catch hold the edge of this tear and try and make a minirhexis out of it. And I am able to get a small rhexis. Now is the time to remove all the liquefied cortex, which will lower the intralenticular pressure, and then the nucleus will behave like any other normal nucleus. There was so much of intumescence that a lot of cortex has come out. So the first challenge of reducing the intralenticular pressure is achieved. Now the second challenge is to increase the size of the rhexis. So a tangential nick is made, and with the help of a utrata, an attempt is made to make a 5.25 to 5.5 mm of rhexis. So now the risk of the rhexis running out is less. And we are able to get a good 5.25 mm of rhexis. Now the third challenge is to break this hard mobile nucleus. So my plan is to do a supracapsular phaco. So one pole of the nucleus is tiled out. This is a fairly hard nucleus. Catching hold of the nucleus in the bag, this mobile nucleus, and breaking it is a tough task. So now I am buzzing into the central core of the nucleus. 1/3 of the dialer goes behind the nucleus and I get a good crack. I am trying to be at the plane of the iris. The advantage is that the proximal heminucleus goes back in the bag, and one heminucleus is out of the bag, which can then be easily sub-chopped and emulsified. The prerequisite is to coat the endothelium with a good OVD. You can see that the chopper is pushing the nucleus down all the time and preventing chatter and the parts of the nucleus going above and hitting the endothelium. Now to deal with the other heminuclei, it's a bit difficult to catch hold of this mobile dense nucleus, but I am able to do so. And once I get two pieces, then slowly but surely we are able to manage it Always try to be at the central safe zone. All the maneuvers should be done with the help of a dialer or a chopper inside the anterior chamber. Sub-chopping, and chop, you can debulk the nucleus as much as you want. Slowly emulsify. The parameters are lowered now, as there is no cushion of the epinucleus in this case. And finally we are able to manage the dense mobile nucleus. Some fibers are there, and we are able to wash them out with the help of a 22 gauge Sempo cannula. Subincisional cortex is cleaned by going through the side port. And now is the time to put the IOL. A wound assisted delivery of the hydrophobic intraocular lens is done. The leading haptic goes in the bag, and the trailing haptic is then gently dialed in. As we have used high OVD, so we need to clean the bag, the anterior chamber going behind the IOL. So the three challenges while doing an intumescent cataract is: first, to avoid the Argentinian flag sign, and to do so, the best option I feel is to create a minirhexis and then clean up all the liquefied cortex properly. Then the second challenge is to convert this minirhexis into a desired rhexis of 5.25 to 5.5 mm. And the third challenge is to deal with the dense mobile nucleus. Once we are through with these three challenges, the rest of the case goes like a normal case. And finally, the wounds are hydrated. And the case is concluded. I hope you like this video. Thanks for watching.